Hi, this is Amanda Johnson, and I completed my project for Kent County. Kent County is located in Delaware, the United States' second smallest state. Delaware has three counties: Newcastle, Kent, and Sussex. Kent County is the middle county of Delaware and contains the capital of Dover, which celebrated its 300th birthday in 2017. I currently live in Kent County, which is why I chose it to study. The population estimate for Kent County is currently 176,824 people, with the median age being 37.2. Kent County is the least populated county of Delaware's three counties. However, we may be the most well known as we're the home of Firefly, the Monster Mile, the Dover Air Force Base, and acres upon acres of farmland. In Kent County, there are three separate school districts, multiple private and religious-based schools, and three colleges and/or universities. 86.9% of individuals aged 25 or older have a high school graduate degree, with 23.1% have a bachelor's degree or higher. In 2016-2017, Kent County had the lowest percentage of high school dropouts for the three counties. Kent County and the state of Delaware in general have been hit hard with the opioid and drug epidemic. The current age-adjusted opioid overdose death rate per 100,000 people is 16.9, with the age-adjusted drug overdose death rate per 100,000 people at 30.8. It's important to note that the following information is only available as statewide statistics due to Delaware County sizes and a lack of individualized formal data. Many DFS cases are now being opened for families due to drug dependencies and usage. In 2017, approximately 3% of babies born in Delaware qualified for a diagnosis of neonatal abstinence syndrome, in which the infant underwent opiate withdrawal. Delaware hospitals are required to report if a child is born with substance exposure to DFS. In 2015 alone, 353 reports of addicted newborns were called into DFS, and in 2016 that number doubled, with the calls reaching 600s. 4 of those babies died in the care of a parent or caregiver, and 3 additional babies were severely abused. In 2016, 20,778 reports were received by DFS. 8,951 of those reports were investigated, with 1,239 of them being substantiated. Of those, 349 were labeled abuse, 597 were labeled neglect, 128 were labeled sexual abuse, and 165 were labeled dependency. From April 2016 to April 2017, 14,519 individuals in Delaware received the mandatory reporter training that is given by DFS. In 2016, DFS added the training on foster care and sex trafficking into their mandatory training profiles. They continue to be the main resource. In 2016, there were 1,104 children who spent at least one day in foster care during the fiscal year. 650 of these children remained in out-of-home placements under DFS services. 89 of those children were adopted, and 2,475 total families and children received services through DFS. Various community resources exist for children and those families who suffer from abuse. Prevent Child Abuse Delaware, or PCAT, is a nonprofit that exists within all 3 Delaware counties to educate the community and provide resources for victims. Other resources include Safe Arms for Babies, Darkness to Light, Child Help, and the Child Advocacy Center.